Okay, doctors, welcome to today's program, today's webinar on Let a Simple Software Explain Ligament Injuries to Your Injury Patients. My name is Dr. Kronk. I'm the Chief Operating Officer of Spinal Kinetics, and we try to bring you programs once or twice a month that are related to what you would be doing. For those of you that don't know what I look like, this is what I look like. I also have a company where I educate doctors on the niche called the spinal ligament injury market. It's a really cool niche. It's the easiest niche in the injury market to monopolize right now. I spend a lot of time helping doctors to do that. And of course, one of the things that the doctor needs when they are doing that market is they need an excellent excessive motion testing service. And that's what Spinal Kinetics is. And that's where you are here today. Now, why is this such a cool market? Because it's absolutely astronomically huge. The number one cause of pain and chronic pain and disability in the world today, in your town, in your state, in this country, in every other country, is a lumbar spine problem. It's a ligament injury to the lumbar spine. The fourth leading cause is a ligament injury to the neck, and the sixth leading cause is ligament injury to the neck that causes headaches. So spinal ligament injuries are the fastest, easiest way I know to build a practice today. I don't care if you want a chronic pain practice or you want to get more into the injury practice. It's absolutely the easiest way. But we're going to talk about, and today we're kind of deviating a little bit because I'm going to bring on a special guest here in just a bit to show you a software that they've created that helps to show patients exactly what's going on inside their spine. So one of the things in the training program that I teach doctors is we taught the most perfect algorithm for working these ligament injuries up. Those of you that want to copy this algorithm, you can get one. You'll just email or call Spinal Kinetics and I'll have them available for you. But it's just a perfect algorithm. Now, one of the things I've found is the majority of doctors that look at this algorithm will look at it and they won't totally understand it. That's why, of course, I have training programs to get it, because it's very simple. But no matter what, in the injury market, you've got to have good, accurate, excessive motion studies, and that's what Spinal Kinetics brings to the table. Now, we have a process that's actually trademarked called CRMA, Computerized Radiographic Mensuration Analysis. And I want to explain to you exactly what that means today, just very briefly, because it's a process. Spinal Kinetics is a company that has a process. And our process is this. We have a male-trained rad techs that look at your images. They say, hey, these are good images. We're not going to have any problems with the images. They look at your paperwork. They say, hey, look, the orders are all good. And they enter them into our system called SmartRead. Once they're into SmartRead, they hit a button, and now it's in Radiologist 1 workload. Radiologist 1 actually plots the points. And then Radiologist 1 says, done. They're then transferred to Radiologist 2. Radiologist 2 then reviews the points and makes sure that the points are accurate, agrees with the points, changes the points if need be. And when they're done, it comes back with a click of a button. Usually within 12 to 24 hours, we actually have that test and the test results. Those test results are then printed and reviewed. They go through one more internal review process. Now, depending on what we find there, there's another licensed doctor review that occurs before they ever go out the door. That's what a CRMA is. Now, that's not currently, that's the most extensive process in the market today. Nobody does this. And that's what we at Spinal Kinetics are becoming very well known for. We're getting more and more. So we are not a software. We don't even cater to those that want to use softwares. That's not what we are. We're an independent, unbiased, radiology-driven read. Very professionally done. As a matter of fact, we're getting quite a bit of press here lately. And I'll just pull up one here. This is Joint Health Magazine, how CRMA is changing the spinal injury and chronic pain industry. We're bringing more awareness and more attention. When I said, look, this is a very simple to dominate this particular market, to really excel in this market, it's because I mean it. It is. It's perhaps the easiest market or the easiest niche to get involved with. This is a big millennial online magazine, and we're getting picked up as millennials are, you know, whenever you have, there's sort of the old procedures, and the old procedures always fight with the new procedures. And so the older practitioners, the older attorneys have always done it this way, and they don't always keep up with the times. Young providers, young attorneys, young doctors say, hey, look, there can be a better way to do these things. And so millennials are picking up exactly what we do in spinal kinetics. So we're really kind of rapidly getting known in this market. And so are doctors getting more known in this market. So again, we are for those that really want, and I'm not going to even spend any time talking about these, just know that that's not what we are. Now, today it's very easy to grow a spinal injury practice in the spinal injury niche, spinal ligament injury niche. And the reason why it's so easy to grow in that niche is because there are relatively very few doctors that are in the niche. That's why. Now, there's a lot of doctors in the market saying, hey, I treat whiplash. But what does that actually mean? So there are very few in the market that really specialize on ligament injuries. And those that do, you know, I train doctors every day. And one of the things that doctors don't realize is how many injury patients, if they want to grow an injury practice, and I a lot of times will communicate to doctors in seminars and say, how many of you have an injury practice? And I get, you know, 20% of the providers there, 80% say they don't have an injury practice. And I say, well, how many of you are treating neck pain? They all do. How many are treating low back pain? They all do. How many are treating headaches? They all do. How many are treating pain going down the arms? They all do. How many are treating dizziness? They all do. How many are treating, I could go on and on and on with the symptoms. And then I can go to a site and say, look, these sites, Medscape, for example, says this is the most common symptom of a spinal ligament injury. So spinal ligament injuries are the easiest way that there is to grow a practice. Now, an injury practice and a chronic pain practice for that matter. So what I was saying is that when you're looking at an injury practice, it's very easy to start to go internally into your already existing patient flow, but your patients have to be communicated in a way that stimulates referrals. I'm going to tell you right now, if you have 1,000 patients in your database, you have 110 injury incidents per year, spinal injury incidents per year in that database. Some of you have databases of 10,000. You have 1,100 injuries in that database every single year. But a lot of doctors are always looking for tools, right? So we say, hey, look, this is the 6th leading cause of disability, a ligament injury to the cranial-cervical junction causing headaches. Number 4 leading cause, number 1 leading cause, low back, ligament injury. Number 4, ligament injury to the neck. So how do you communicate to people what makes you unique? Well, for providers that do ligament damage, the reason why I brought on today a specialist is we have Robert Rocco with us. He's the president of 3D Practice, and he's developed educational products. I spoke with Robert, I think about a year ago, and then we talked at that time about him incorporating some basic ligament information and animation into his software, which he did. And then we just spoke recently again, and I reviewed some of the stuff that he was that I looked at, and I said, wow, this is a really great tool, exceptionally well priced, and just a fantastic tool to explain to people. You know, I've said for years, and I've oftentimes went out when I'm in shows or want to show somebody, hey, you can feel a lot of doctors have problems with new patients. There is no scarcity of new patients once you're in the ligament realm, because everybody that has chronic pain is suffering from an undiagnosed, the majority of them, an undiagnosed ligament condition. If you know how to diagnose it, then it's simply explaining it to the patient. And that's why I brought on Robert today to show you a very simple software system that he's created. And Robert, welcome. I'm gonna turn over the presentation now to you. So you're gonna just see a pop up on your desktop, and I'll turn it over to you so you can show us your system, introduce kind of who you are, what you are. I mean, I have printed up here, kind of a little bit about your background. But why don't you talk just, and what I want to do, Robert, is show the doctors what you showed me. You have a video of a patient in an auto injury.
Yeah, correct. Yeah, thank you, Dr. Kronk, for that introduction. That's wonderful. Thank you, everybody, for being on board today and allowing me to show you my product. And Dr. Kronk put up a slide there. It had some information about my background. You're probably wondering now, why does somebody who's got a master's degree in electrical engineering and used to work in Motorola, what's he doing now in chiropractic, creating patient education software products? But I actually started out as a biomedical engineer as part of a research team, medical research team. So my love has always been technology and medicine, and I love chiropractic as well too. So I was introduced to it back in probably about 2002, 2003, and just noticed that there was a lot of concepts that even I didn't really understand very well. So I started putting together some patient education software products. It's grown into what you see here in front of us today, which is called virtual consultation. I own a business called 3D Practice, and this was actually the first product we put out there. Again, it's called virtual consultation. It's for report of findings. It allows doctors to show patients conditions and treatments very, very quickly. Initially, it was designed for a 5-minute report of findings, so everything was 1 to 2 clicks away. You can do a lot with the program. It's really grown over the years, and I'm just very lucky to have a lot of good relationships in chiropractic, a lot of conversations with the doctors, finding out what their pain points were, and what sort of kind of stressed them out a little bit at the end of the day. And being able to communicate with patients was kind of loud and clear for me. So let me just give you an overview of the product. Again, it's a report of finding software product, but you can do so much more with it. So on the left-hand side, these are the different categories of conditions and animations and treatments. That's kind of the bread and butter of the product. And the doctor can go through and click on things very, very quickly and show a patient a condition in different scenarios. This is where you should be, this is where you are, this is where you go without the proper care. And of course, all the charts, the nerve charts and the organ charts, all that is built into the program as well too. There's a lot more you can do with it. You can market on Facebook with it. There's an introduction to chiropractic care video that you can run. You can run these animations in an automated manner as well too, so you can do passive patient education. Just kind of set it up and walk away if you want. What I'm going to focus on here is just the personal injury side of this program and what it offers. So, in this case, I'm going to bring up this window. And can you see this okay, Dr. Kronk?
Yeah, totally. Okay. That's great.
So I'm going to bring up an animation. And what's really cool about this one here is that it's totally interactive. So this shows a rear impact auto collision, except it's interactive, and I can turn it and I can zoom in and I can play and step through the mechanics of a rear impact auto collision, and then zoom in if I want and take a look at the soft tissue injury, be able to show that to a patient. Doctors are also using it during depositions and court cases as well too. So if you have a touchscreen computer, you can pinch to zoom, or you can just use a mouse and drive it that way as well too. So let me do that. I'm going to go ahead and step through this animation, and based on the research, we know that during an impact, everything accelerates forward. And we can see the body is lifting upward. We can see the thoracic spine is straightening out. The shearing forces along with the upward forces are creating that S-shaped formation in the cervical spine there, right? So this is great for illustrative purposes, again, whether it's in the courtroom, depositions, or with a patient. And then I'll step through it just a little bit further. We'll go through hyperextension, hyperflexion. Now, at this point, we've gone through the mechanics, but we can go ahead and zoom right into the cervical spine and see some of the possible conditions, the soft tissue injury that may result. So what I'm showing here is the C4 vertebrae has slid forward. Why is that? Well, there's also a little bit of tearing of the anterior longitudinal, but I can swing it right around to the back and zoom in and see other types of injuries. So we know that C4 vertebrae slid forward. That could be because there's tearing of the facet capsules and tearing of the posterior longitudinal ligament, either or. So that's just one example you can show there, and you can show this from different angles. So if you want to watch the mechanics from this view right here, see the damage that occurs, you can do that as well too. So that's kind of a good starting point. Most of my doctors that use the product, they'll show a patient, one or two or three different types of things here. In fact, let me just show you one more thing on this menu. So you may want to be able to talk about the dermatomal patterns associated with the injury. So that's another feature that comes with the product. Here you can go ahead and select the different vertebral segments. If a person has a problem with, say, the C5 segment, then this can be the numbness and tingling, those areas that they experience those sensations. So C6, you can go down to C7, C8. So there are the referred patterns of numbness and tingling that may be associated with that injury. So it's great to make that connection with a patient. You show it to the patient goes, "That's it, doc, that's exactly what I've got." And then if we go back over to the main part of the program, that was the personal injury module. We're going to show a little bit more here in terms of the soft tissue damage and what happens. So now we're taking a look at a set of animations. I can go ahead and advance that. I can click play, or I can just manually move it. And this is something that a lot of doctors ask me to put in. And when I talk to Dr. Kronk, it's, okay, I'm over the top, I'm ready to do it. And basically what it does is it shows the damage to that ligament right there. So you can see that ligament is no longer tight. It may be stretched or torn. And then when this person goes into flexion, there could be hypermobility of that joint there. So this is a nice way to explain it to the patient. They'll see the x-rays, they'll get it, but when they see the color 3D model, it definitely helps out communicating that message. Now, if it's the anterior longitudinal ligament that is instead stretched or torn, we can go ahead and show that. And then when they go into extension, there you go. There's the hypermobility in that direction too. If we go over to the C1 segment, we can go ahead and remove the head. And then if this person has damage to the upper cervical ligaments, they may see hypermobility of that C1 segment as well. So those are just a couple of examples. We can take it a step further. If we want to go ahead and show the degenerative changes over time, we can do that. We can also go ahead and show not only have we proven there's soft tissue damage because there's hypermobility, but guess what? The patient has to understand that there's a healing process. And by the way, there's sources that come with this too. So when I click on this little book, in this case, it'll tell you where we got our source, and we used Kellett. And basically what it does is it explains the soft tissue healing process. And what the studies tell us is that if you have an injury, soft tissue injury, and here it is, right there on the anterior longitudinal ligament, we can go ahead and show that during that healing process, the first phase is going to be acute inflammation. That could be 48 to 72 hours of that process, that stage. Then we get into the repair and regenerative stage there. That could be 6 weeks or longer. And then remodeling and maturation. Now, if you take a look on the right-hand side, what we're going to do is we're going to show that active care is the key. You can have two outcomes, active care versus passive care. And this is really what I think patients have to understand. Good compliance, super, super important. So what happens is that scar tissue layers over that injury. And if the, grab my mess there, if the scar tissue lines on top of that, basically in the same direction as the ligaments, then guess what? That's going to be much stronger and it's less likely to break down over time. Now, if that patient skips visits, doesn't get the proper care, you get more of that crosshatch pattern there. And that segment there, basically, the soft tissue there, can break down much more easily. The patient can live with chronic pain. So this is a great way to emphasize, hey, good compliance is very important. This healing process could be a year or longer as well, too. So I think up front, if patients understand that, it's going to help the doctor out as well with good compliance. So those are just a couple of things. There's so much more you can do with the product. You know, if you want to get into the degenerative changes over time and the cervical spine, you can do that. We can launch some of the nerve and organ charts if we want to as well. There's just so much more. We can get into posture and those changes over time, and then we can get into some of the treatments as well too. So how does that sound, Dr. Cronk? Did you want me to?
Robert, great. The other aspect of a ligament injury to the spine, of course, is the disc, and you have a pretty impressive disc where you're showing the disc herniation. Go ahead and show the doc. Yeah. So go ahead.
Yeah, and this one came right out of Essentials of Skeletal Radiology. And we tried to make this look like an MRI with a lateral view and an axial view. So we can advance this, and patients get it right away when they see it. So there's a left lateral bulging disc, right? We could, with one click, switch it to a centrally bulging disc. Or we can switch it to a posterior lateral herniation with prefragment. Of course, there's a drawing tool built in as well. So if we want to go ahead and emphasize, this is how we're going to treat it. A thicker pin, we're going to target that segment, maybe we're going to do some flexion distraction or whatever, adjust that segment, targeting that joint right there, whatever it is. And then of course you can capture this information. There's a little capture button on the right. You can go ahead and build a report with care plans and exercises. You can even post that content to your Facebook page as well.
Now that's beautiful. Doctors, if you have any questions just while you're listening, just type them into the question box. If you have any questions, now's the time to ask them. Just go right into the question box and just go ahead and type them right in. Robert, you were saying that, and I know I saw this before, you have also like the old nerve chart.
Yep, correct. Yep.
I know.
So we've got several different types of nerve and organ charts here. It just depends on which one the doctor prefers. So if we go over to the symptoms button here, we've got, this is our first dermatomes chart. I showed you the more recent one, but we left the old one in there as well too. Some docs prefer it. The myotones chart's in there as well. Peripheral nervous system chart. So if you want to explain to the patient and make that connection and say, look, here's the referred pattern of pain because you've got a mid-cervical segment there that has damage, then you can do that as well. The original organ chart is in here as well too. We also have a really cool 3D nerve chart in here as well too. My doctor close by actually had this poster and pushed me quite a bit to put this particular animation into the product as well too. But this is going to come up, and this is a 3D organ chart here too. So what's really cool about that, as soon as it comes up, is that we can turn it and look at it from different angles here too. And each one of these organs is actually an individual 3D model. But you can see the nerve impulses, they travel from the brain down the spine over to the organs and back. If there's a problem associated with the C1 segment, then guess what? That could affect the flow of activity. You'll see all those nerve impulses kind of slowing down. If there's a problem with, let's say, T2, that could be the heart, C4. So that's, a lot of doctors have this organ chart. We put it into the program. We really want to make it come to life for the patient to understand it.
Yeah, absolutely. I mean, I think it's critical for injury patients to understand the full ramifications of their injuries so that they, at least in my own private practice, so they stay very compliant with their care, because the thing you want to do is you want to get an excellent result. And the only way that excellent results are achieved, I practiced for 17 years, was with excellent communication with the patient, having the patient have an excellent understanding of what you're doing. When I found what would happen with that is that compliance would go up, get better results, and of course with that comes more referrals.
Right.
And the other thing that comes with it, doctors, that I found is there's a higher sense of professionalism, because the patient's actually looking at things, and the fact that the clinic took the time to explain the condition or explain things. I don't know, I just got a feeling like there was a higher level of professionalism that we were offering them, just as you already are all striving to do. Richard, I do have a question. Is this part, the question is this part of the Visual Odyssey program?
No, that's a whole separate company, a whole separate program.
Okay, good. Nope, doctors, this is just a separate standalone product. So again, the reason why I wanted Robert here today is again, I train doctors, and when you just think with the fact that for every 1,000 patients you have in your database, you have 110 injury incidents. Most injury providers that want to get to have a larger injury practice, the biggest problem that they have in the market is they're obscured. Nobody knows they're there. The easiest place to start is with your own database, your own practice. Robert, you were saying anything else that you want to show is fine. And you were also saying, I know how to love it, how much.
Right.
You're not gonna, before he tells you the price, you're not gonna believe the price. It's amazing what he puts this out at. What's the price?
Yeah, the price is still $495. So we have a separate program, and it's a one-time fee. And I know I've told you about this. We're planning on moving over to a subscription model here very, very shortly. So right now, it's still a one-time payment of $495. You actually get 3 months of free software updates. So things that we're currently working on, once you purchase it, I want to make sure you get those. I don't want you to be surprised a month later. But the product is very mature. It's been on the market since 2004. Again, we've been working on it diligently all the time. We're always adding to it and making it better and better. But it's just a flat fee of $495 at this point.
And how would they buy that? They go to 3D.
Yeah, they could either call me. Let me go ahead and put my number up. So it is 866.
I'll put it back up.
Yep, 399-4009. So it's, you can give me a call back. And my name again is Robert Rocha, and happy to talk to you. You can also go to the website 3dpractice.com, take a look, and you'll see some of the animations, a little bit more complete set of animations there than we went through today. But again, there's so much you can do with it. There's the report of findings, there's follow-up exams. You can run it in an automated fashion in your reception room. And then the other thing too, doctors have been asking for years and years, can we post this content on Facebook? Can I put some of this content on our website? And the answer is yes. And there's ways that we kind of help you go about doing that. Facebook is actually built into the product as well too. It's very cool. So you click on the capture button, comes up. It takes a screen capture along with your drawings. So literally you have unlimited amount of graphics that you can post up there. And that's the challenge everybody has, right? You want to put interesting, compelling graphics up on Facebook and put it out on YouTube. We give you a library to access that. And literally in a matter of 5-10 seconds, you can post something and do it once or twice a day, every single day.
Yeah, that's actually really huge.
Yep.
Because that's one of the things that we teach doctors to market, and you have in order to come out of obscurity, you actually have to post, you have to message out your message. And just the fact that you could take and highlight something or put a marker on something, point to something, write on it, these would be really, really valuable for not only for yourself, but for the person that's doing your PR.
Right.
If I could put a arrow with a neck, we treat neck injuries from auto injuries, call 866-399-4009. You got to think about that, doctors. That's a really different, and something that's different interrupts. Because remember, you're fighting for attention, so it interrupts their attention. That's fantastic.
Yeah. Well, and you think about the report of findings, that may be your one opportunity to take care of that patient, give them the care they really need. And it's great for the patient, it's great for your practice. So, that's why I always try to encourage doctors, put your best foot forward. Instead of running that paper chart plastic model, you got everything you need right here. And it's just a heck of a lot more compelling for the patient.
Absolutely. Absolutely. I'm gonna change back, unless do you have anything else you'd like to show, Robert?
No, that's it. And again, thank you everybody for having me on. And it's a privilege to be here and be able to show you my software.
Yeah, so no, I appreciate it, Robert. So for those of you, again, here's a number right here. Should be able to see my screen. Everybody can see my screen, correct? Everybody still see my screen?
I can see it.
Okay, great. So you want to give Robert a call. Either go to 3dpractice.com or give him a call at 866-399-4009. If you want to, he'll demo more for you. I mean, this is a software I personally would own. This is a no-brainer software as far as I'm concerned, because it's hard. I spend a lot of time looking for sources of ways to explain things to doctors and explain things to patients. This would make life very, very easy in the explanation process. Like he said, you can screen capture, you can print off, you could create a booklet. There's all kinds of little things that you could do. And I thought it was fantastic. I thought we'd kind of take a little different step this week on our webinars. For those of you that are not or are in the market and want to have unbiased excessive motion testing done and you're not currently with Spinal Kinetics, give us a call at 877-508-9729. We will easily set up your practice to be able to handle your spinal ligament injury testing, or you can visit us online at www.thespinalkinetics.com. Doctors, we do very short, right to the point programs, trying to be very mindful of your time. I appreciate your time today. Both Robert and I appreciate your time. Robert, we appreciate you coming on. And doctors, tune in again for our next, just stay right on our email lines for our next webinar. Thank you very much and have a great day.
Yeah, thank you, Dr. Krog.
You're welcome.